You say that you want to protect them. How can you make sure that they will be protected?
I took this job to do just that, protect our most vulnerable. And yet the plans that I've been asked to preside over, Medicaid and the Affordable Care Act exchanges in particular, are not stable programs.
So Republicans released their version of President Trump's spending and tax cut bill this week. And while Republicans are divided over their proposals to Medicaid, Dr. Mehmet Oz, administrator for the Centers for Medicare and Medicaid Services, has doubled down. So hello, I am Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are eh-yah,
Black and brown women, disruptors in healthcare and beyond. So here we are. And what they don't want you to know is while you were working two jobs, trying to make ends meet, Congress is trying to once again rip off the foundation of Medicaid. So let's be real. This isn't just a targeted gutting of the system. It's about millions of people that rely on this system. It's not just about budget adjustments anymore. And so the senators, their latest proposal, you guys, up to $1 trillion in cuts to Medicaid. And somehow that's even more brutal than the version that has already passed in the House. And so what gets worse is that even some of the Republicans, such as Josh Hawley from Missouri and Jim Justice from West Virginia, objected to one key provision. It's a cap on a type of tax known as provider tax. That's the system that states use to fund their own share of Medicaid by taxing healthcare providers like me and Dr. Brown. Sounds complicated, right, Dr. Brown? Let's roll this clip.
Surprised that the Senate has decided to completely depart from the House framework when it comes to Medicaid and the provider taxes. I was told we've got a fix on the provider tax issue. We're going to help rural hospitals. There's nothing in here for rural hospitals. In fact, what they're doing is lowering the provider tax to make it even worse. So it's like we're defunding rural hospitals in order to pay for extensions to the Green New Deal. Like I don't get it at all.
Yeah, I don't get it either, Dr. Brown. What do you think?
So, if you've been following the headlines or these backroom clips that never make prime time, you may have caught that United States Senator Josh Hawley of Missouri, he's expressing this so-called concern, right? He's concerned about the Medicaid cuts in the latest Senate proposal. But let me be clear. When a Republican senator starts talking about reductions in growth instead of saying the word cuts, that's your first red flag, right? I mean, let's be honest. Slowing down funding, limiting eligibility, and tying up access in red tape isn't reform, it's sabotage. It's not trimming fat, you guys. It's cutting the arteries. And the blood that they're bleeding out is a healthcare program that actually covers 1 in 4 Americans, from children to veterans and working parents. So let's not forget here. Medicaid was expanded under the Affordable Care Act, a law that Republicans have tried to gut at every single turn. And that expansion is the reason why millions of low-income adults, especially in Black and brown communities, finally got access to care. And now they want to reverse it. Hawley said he was surprised the Senate moved further than the House's brutal framework. But instead of standing up for his people back home, the ones that he's representing, right, the Senate leadership is just doubling down. They're gutting Medicaid deeper by capping something called provider taxes, a crucial way states raise money to unlock federal Medicaid dollars. So when you limit or phase out those taxes, states get less money from DC. Period, you guys. And so what happens with less money? Rural hospitals close, behavioral health programs vanish. So we keep talking about the importance of mental health, but that's a moot conversation if we don't have the providers to provide mental health support, right? OB-GYN, pediatricians, and specialists, they all disappear, and especially in Black, brown, or Indigenous and low-income communities. And here's the insult on top of the injury. While slashing your care, they're pushing a big, beautiful tax bill that hands even more breaks to billionaires and the top 0.1%. And let's just talk numbers a little bit here. Right? The same Republicans that are crying these crocodile tears over the federal deficit are pushing tax cuts that cost over $4.6 trillion. And while Medicaid cuts just save a fraction of that. So it's really not fiscal responsibility, you guys. This is a heist. Because here's the truth. It's not about tightening belts. It's about shifting burdens from the working people to the top 0.1%. That's where the money's going. So tax giveaways to hedge fund managers, budget shortfalls. It's dumped on single moms, essential workers, and disabled folks just trying to see a doctor. And what they don't want you to know is that among adults under 65 on Medicaid and those who aren't receiving disability benefits or Medicare, 92% of those folks are actually working. They're working. They're in their employment, their workplace, they're in school, they're caregiving. And that's the real story, because really only 8% of those that are receiving Medicaid are out of work. And so it's just a really, really, really tired narrative that Medicaid recipients are on this free ride. It's not. They're not. It's a lifeline. It's especially a lifeline for individuals that are working in industries like agriculture, retail, food service, jobs that don't come with decent healthcare at all. Did you know that Walmart is actually one of the top private employers of individuals receiving Medicaid? Yeah, Walmart. So over 10,000 of its workers in just 6 states rely on Medicaid because their wages aren't high enough to afford healthcare. So really what we're seeing is that these large corporations are relying on public assistance. So it's not fiscal responsibility. These Republicans are capping provider taxes and defunding Medicaid, and they're not just targeting low-income families, they're dismantling a key pillar of the Affordable Care Act. They're collapsing the very foundation that keeps our healthcare system functioning. They're dismantling a key component of the Affordable Care Act. And then they have the audacity to call it fiscal discipline. It's not fiscal discipline. It's fiscal gaslighting. And we've seen this playbook before. Starve the programs, blame the victims, then privatize for the wreckage. This bill is being held together by tension, greed, and hypocrisy, and it's going to explode. And the CEOs aren't the people that are going to get hurt. It's going to be us, physicians, nurses, kids, patients, these families showing up to the emergency rooms, uninsured, out of options, and forced to rely on the most expensive, least accessible form of care. It's not just bad policy, you guys, it's a moral failure, and it's an assault on everything that the Affordable Care Act was meant to correct. Don't let them deceive you, don't let them make you invisible, and don't let them call this progress. See it for what it is, because we're not going to back down. And then, of course, Dr. Sloan, we have Dr. Oz speaking further on the topic. Let's roll that clip.
First off, we already know what happens when you take people off Medicaid. We just did it for the last 2 years. Under the Biden administration, 15 million people were disenrolled from Medicaid. 15 million. The uninsured rate went up about 10%. Went up 1.5 million people. So the vast majority of Americans, and I have confidence in the Americans' people, if you give people a chance to work or volunteer, participate in your community, go get an education, or lose your insurance, they take the job over that. And so the estimates that we're seeing are made by economists, but it's a behavioral analysis. It's a psychology analysis. Will you take the deal?
This is a man that has never struggled a day in his life. And let's remember, he's also the same man who got to where he is. The platform that he is reaping the benefits and harvest was by a Black woman named Oprah Winfrey. So let's set the record straight. No, Biden's administration didn't kick millions of people off of Medicaid. What actually happened, that COVID ended and the COVID emergency, and with that, a new era of Trump that paused all of the Medicaid checks. So now the states, mostly GOP led, rushed to dump all those people off the roll. And so 20 million people have been dropped. And here's the rub. Most of those people actually still qualified, you guys, but it was due to cuts and paperwork problems. So that's not reform. It's just sabotage. And so now here we are, Dr. Oz. We knew it was going to eventually come back to bite us in the ass. Now serving as the 17th administrator of the Centers for Medicare and Medicaid Services under Trump's administration, took to the airwaves on Tuesday talking to CNN about these Medicare reforms. And so he had 2 things to say, or prioritize, I should say. Number 1, we must protect the program for the low income, elderly, and disabled. And he framed this as his central mission, signaling his focus on preserving the core beneficiaries. But his second thing was about crackdown on abusers. And he called this for tighter verification and preventable, really trying to block ineligible individuals, specifically the undocumented immigrants, from receiving any type of Medicaid. Though he did not have an outline or precise enforcement mechanism at this point that he was talking about. Dr. Oz's message at this point reflects a very careful balancing act. He claims to champion coverage for vulnerable populations, but he's also pushing, and don't miss it, stricter gatekeeping. It mirrors the administrative's tightrope that he's walking, preserving Medicaid's core, but reshaping its boundaries under political and budgetary pressure. So don't be fooled, you guys. This is not cost-saving measures. What's happening in Congress is very calculated. It's an effort to dismantle Medicaid, piece by piece, and sell it as fiscal responsibility. However, beneath that budget language and political jargon lies a moral failure with real human cost. So the Senate is considering, get this, $1 trillion cuts to Medicaid over the next 10 years. That's not a trim, that's a gutting of a whole program that supports millions of people. And so who is going to be affected by that and how? Those that have stricter eligibility rules and more bureaucratic red tape, like we need any more of that. Work requirements for low-income adults, caps on provider taxes that the states are using for Medicaid, and up to 10 million people could lose their healthcare coverage, and over 1 million healthcare jobs. 1 million healthcare jobs are projected to be lost. You guys, we cannot afford any more losses in healthcare. We're already under water right now. So the provider tax issue, it does matter. States rely on hospital contributions to secure federal matched funding, money that helps rural hospitals open, support hiring nurses and staff, and provides care for low-income families. Those proposed caps mean states will get fewer federal dollars. And even if they're willing to contribute more themselves, they're not getting any more money. So that forces states into a corner, right? They're either going to raise taxes elsewhere, that's going to hurt more people and more likely the low income, or they're going to cut vital health services. And my guess is it's going to be the latter, or inaction, where the vulnerable people are going to end up falling through the cracks. So it's not reform, it's a quiet unraveling of our public health safety net. And the groups that are going to suffer the most, we already know, they're the ones already at the margins. Children in low-income families, seniors in long-term care facilities, people that live with disabilities, essential workers that don't have job-based insurance, rural hospitals, communities that just don't have access, have to drive miles, hundreds of miles sometimes to get access. And of course, yours truly, Black and brown families that have already been battling what? Systemic health disparities. So this is not accidental. It's structural divestment and deliberate pullback from the health and public infrastructure under the cover or the guise of budget discipline. Politically, you guys, this is a hot mess. And Republicans in Congress are actually split. Some of them want to deep cut this and reduce the deficit. And then there's others that really do fear the backlash of the constituents that do rely on Medicaid. So meanwhile, you can promise you that no Democrats are going to sign off on this bill. But there's some GOP lawmakers that are negotiating with themselves, trying to figure out how to make the cuts that don't cost them what? Votes, right? It's not even about us anymore. It's not about the people. But here's the truth. You cannot shrink Medicaid without expanding suffering. And that's what's about to happen. So this proposal is going to widen the racial and the geographic health disparities that we already have. It's going to increase the number of Americans that are driven into medical bankruptcy, you guys, and push more people into overwhelmed emergency rooms. What they just said is not going to have what? Healthcare providers. And worse, put more people in jail and maybe even early graves. So hear us when we say this. Medicaid is one of the last remaining pillars that holds healthcare together for underserved Americans. And now slashing it is not just a policy decision, a budget decision. This is an ultimate betrayal.
Listen, right? Dr. Sloan, we've both stood in hospitals, patients' rooms or in the ER holding the hands of patients whose lives would have been longer or better or even saved if they had access to preventative and consistent care. We know that there's a human cost to these cuts, and that's why we're speaking out. But it's more than just policy, right? Again, it's a reflection on who are we as a country. Do we protect our most vulnerable or do we abandon them? So just keep showing up, guys. Keep resisting. And thank you for watching. We are eh-yah, contributors to the MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Goodbye, everyone.
Have a great week.
Love this video? Make sure you stay up to date on the latest breaking news and all things Meidas by signing up to the MeidasTouch newsletter at MeidasTouch.com/newsletter.